Hi everyone, Dan Julien here, nurse practitioner for Danesthetics Medical, and our clinic is located here in Ottawa, Canada. Today we are talking about the dreaded pillow face. Let's be honest, a lot of you are afraid of getting dermal fillers because you're afraid of looking like this or like that. Is it possible to avoid looking overfilled if you continuously use dermal fillers over time? This is going to be an eye-opener for all of you. Let's get into it. Big news everyone, I am now board certified through the Canadian Board of Aesthetics Medicine. And if you're a medical aesthetics provider looking to be board certified, then I highly recommend shadowing us through our Patreon account. This will grant you access to the board certification platform at a discounted rate, and as a bonus, I will also provide you with your own certification through Danesthetics Medical. Click the link below if you're interested. Let's get back to the video. First of all, I'm a big advocate for hyaluronic acid fillers. In the right hands, they can do wonders. You just have to understand how they work and how long it takes for it to break down. Let's get into that. So let's jump into it. You're ready to get your cheeks done. You seek a qualified medical aesthetics provider. And with a typical hyaluronic acid filler, they're going to say, this is probably going to last about, give or take, 1 year. And then you say, okay, so I'll just come back in a year and get this done again? Yep, absolutely. Wrong. That is the first reason why people end up looking overfilled. The reason why is because there's actually two answers for the duration of hyaluronic acid fillers. First is going to be the aesthetic duration, and then the second is going to be the degradation of the filler itself. So often enough, whenever you're going in for, let's say, cheeks or jawline, typically we're using a thicker filler here, something that's very robust and takes about 15 to 12 months before it fully breaks down and integrates into your system. If you're filling every 12 months, well, maybe the first and second time you might not notice much, but your third to fifth time, this is where you're going to notice your face starting to morph and shift a little bit. I know you're thinking, well, if HA fillers last about 1.5 to 2 years, but the aesthetic result is only a year, then what am I going to do as a buffer in between then? What we can do is we can blend it with something called Radiesse, which is calcium hydroxylapatite. This dermal filler is a volumizing filler, very similar to your HA, but as it breaks down, it stimulates and makes collagen. It will never make you look puffy. The downside is that you can't reverse it. So you have to have confidence in your provider. And blending it with hyaluronic acid is nice because then it gives you a little bit of wiggle room where if something wasn't perfect, you can add a little dissolver there and it'll soften it just a bit. It's an injectable where we place in the fat pads. It stimulates collagen and the collagen adheres to the muscle. So these mobile fat pads, which typically slip forward, will stay upright. And it will give the impression that your dermal fillers are lasting longer. Now remember, there are 3 key factors of aging that we can treat with non-surgical outcomes, and that includes skin laxity, which you can treat with radiofrequency or lasers, wrinkling, which you can treat with neuromodulators, and then volume loss, which you can treat with dermal fillers. But if you're relying on dermal fillers to do it all, then you will look puffed up. If you're relying on only anti-wrinkle medication, then your skin will look saggy and you'll have a lot of volume loss. And if you're only relying on lasers, then you're going to have a lot of wrinkles and you're going to have a lot of volume loss as well. So it's a combination of those 3 things done well in order to make sure that you look as natural for as long as possible. Now, if you're wondering, how is it possible that a top celebrity could ever be overfilled by the top plastic surgeons of the world? The answer is because this is a completely independent practice that you have to take on the side after you've graduated. And only then, if you're 100% disciplined into that focus, will you have a good understanding of not only how to do it well, but safely, and how to make sure that someone looks good 20 and 30 years from now. So think about that. Until the next time, take care of yourselves, exercise daily, and please be nice to absolutely everyone. Take care.